Mary was 27 years old, young, healthy, and working as a nurse. Every morning she woke up full of energy, but that morning, the moment she opened her eyes, she knew something was terribly wrong. She could feel her heartbeat, only this time, it was different. It wasn't pounding in her chest. It felt like it was pounding inside her head, and that sound, it echoed deep within her ears. For weeks, she had been dealing with headaches, sometimes a faint ringing in her ears, but she blamed it all on long shifts and sleepless nights. Nursing wasn't an easy job. This morning, though, was unlike anything before. Every beat of her heart seemed to throb at the base of her brain. When she lifted her head, the sound grew even louder. As a nurse, she knew this wasn't normal, but panic quickly drowned out her clinical reasoning. She rushed to the hospital, not as a nurse reporting for duty, but as a patient fighting for her own life. The ER looked different today because she was the one in the hospital bed. Her blood pressure was slightly high, but then came the moment that changed everything. The doctor placed the stethoscope on the back of her head and actually heard her heartbeat. It was a rare finding, and it could be dangerous. An MRI and angiogram confirmed the diagnosis: pulsatile tinnitus, a pulse-synchronized ringing in the ear. A small but dangerous bulge in a neck artery was transmitting each heartbeat's pressure wave straight into her inner ear, echoing in her brain. The doctor warned her, this could lead to a stroke or a fatal brain hemorrhage. The decision was clear: emergency surgery. Her heart raced. Inside that operating room, it was a race against time. Hours passed. The artery was repaired, and then silence. The pounding was gone. For the first time in weeks, she couldn't hear her heart. That silence became the most beautiful sound she had ever known. Hearing your heartbeat in your ear isn't just a sign of exhaustion. It can be a life-saving warning. If you experience pulse-synced ringing, headaches, or blurred vision, don't wait. See a doctor immediately. Have you ever noticed a strange sound coming from your own body? Subscribe now and share your story in the comments. Your experience might just save someone's life. Jessica was 31 years old, a dedicated, compassionate nurse with 10 years of experience in one of the busiest hospitals in Chicago. She had seen everything from broken bones to life and death emergencies, but she never imagined that one day she would be the patient on the other side of the bed. It started on a rainy Tuesday morning. Jessica was halfway through her shift when she felt a strange pressure building behind her right eye. At first, she brushed it off, probably just eye strain from staring at medical charts too long. But within minutes, the sensation escalated. The pressure turned into a sharp, stabbing pain. Then came the nausea, and her vision blurred so badly that the fluorescent lights above seemed to smear into streaks. She tried to keep working. Nurses were used to powering through discomfort, but then it happened. Her right arm went completely numb, and the blood pressure monitor she was holding slipped from her hand, clattering to the floor. Jessica's heart sank. She knew what these symptoms could mean. As her patients' voices turned into muffled echoes, her training kicked in. This wasn't just a headache. This could be a stroke. The irony was surreal. Her coworkers, people she had worked alongside for years, were suddenly rushing toward her with the same urgency she had shown countless times before. Within seconds, she was in a wheelchair, being pushed toward the CT scan room, not as a nurse in scrubs, but as a patient in danger. Her vitals were alarming. Blood pressure was dangerously high, heart rate erratic. The scan results came back fast. Aneurysm. A balloon-like bulge in one of the arteries in her brain, at risk of rupturing at any moment. Jessica's mind was racing. She knew exactly what a rupture meant: massive brain bleed, coma, death. There was no time for denial, no time for fear. The neurosurgeon's voice was calm but urgent. We have to operate, now. As they wheeled her into the operating room, Jessica caught a glimpse of the clock on the wall. She remembered thinking how strange it was, how every second suddenly felt heavier, more valuable than ever before. The surgery was complex. Surgeons worked for hours, carefully placing a titanium clip to stop blood flow into the aneurysm. The risk was immense. One wrong move, and she might never wake up. When Jessica finally opened her eyes, the lights above her were soft, not blinding. Her vision was clear. Her arm moved when she told it to. She realized with overwhelming relief that she had survived. Days later, as she sat in her hospital bed, Jessica couldn't shake the thought: how many times had she told patients to listen to their bodies? How many times had she reminded them that early symptoms could save a life? And yet, she had almost ignored her own. An aneurysm often has no symptoms until it's too late, but when your body sends even the smallest warning, blurred vision, sudden weakness, severe headache, don't wait. Get help. Jessica returned to work months later. She still wore her nurse's badge with pride, but now she also wore a tiny scar just above her temple, a reminder that life can change in seconds, and that sometimes the patient you save might be yourself. Have you ever experienced a symptom that you almost ignored? Subscribe now and share your story in the comments, because your story might save someone else's life.